Hi, my name is Joe John, and this is Mentorchat. And today we have Dr. Shyamala Karnam from Shubhakara Dental Clinic, and she's coming with a lot of experience. She's a gold medalist and comes with around 17 years of experience, out of which 14 years as an academician, as well as 4 years having her own brand, practicing out of Banshankari. Welcome to Mentorchat, Dr. Shyamala.
Hi, Joe. Thank you so much for calling me here. Very happy to be here.
You're welcome, ma'am. So today the objective is to understand a little bit more about your journey, both from a personal perspective as well as a professional perspective, with all your years of experience until where we are today. So can we start with your education, where you're from, and what was your outlook during your schooling, towards selecting a career path, and how it evolved to where you are today?
Okay. I did my schooling in a small town called Bidar in North Karnataka, and I was a pretty good student from the beginning, and I stood second to the district, and I topped in my class 12 as well.
Awesome.
I took science stream and always wanted to become a doctor.
Okay.
Yeah, and I must say now that God chose this path of dentistry.
So how early was it that you wanted to become a doctor?
From the beginning, it was
not a dentist per se, but a doctor.
Yes.
So the idea is to heal people.
Yes, to serve people. I was always fascinated, whenever I went to the hospital, how the doctor was communicating with us, how he was treating and healing people, and the smile the people were leaving the clinic with. All that has always fascinated me, and I was always passionate about becoming a doctor. And that was also nurtured by my parents, my father and mother, that yes, you do what you like to do. And with that, my focus was on biology and all these science subjects, never math. So that kind of was my preparation to become doctor. So I did well in the entrance exam as well. And then, as I said, God chose this path for me as dentistry, and that kind of a blessing in disguise, because I'm also an artist. With an artistic hand, dentists can do wonders on patients when we are treating patients. So this has been...
I wanted to know a little bit more about the artistic hand. How do you explain that?
I'm again passionate about drawing, sketching, painting. I developed a lot of interest in clay modeling. So I keep doing a lot of models with, start with Ganesha model, and then a lot other. We did keep a clay model stall in our college event. So such things. So that was, that can happen if you have fine fingers to, that helps in doing a finer treatment, because teeth are very small and we need to do a lot of things in that tooth.
More detailed
work, fine work. And it is the dentistry itself is defined as art and science. So that art part is very integral part of dentistry. So that kind of helped me, having this skill, helped me serve better and give better results to my patients.
So whether it's bringing out the aesthetics,
designing the smile, giving a very fine bite with the filling, that it doesn't interfere in their
I think the teeth also gives you your shape of the face, like the jawline, stuff like that.
Yeah, though it is mostly neglected part in the body, but teeth, now the awareness is increasing. The teeth are a very important organ of the body, because through which you digest food, the food goes inside, and when you smile, it gives you that emotional support. The social communication is better when you have a lot of confidence
when you're facing.
Yes. So a lot of patients come to me to get good smile and a brighter smile. And of course, a good bite, and those give support to the joints, and the pain is less. So lot angles, if you look at, the teeth are very important for people to do better in their life. So this is how, having said that I took up Bachelor of Dental Surgery training in COTS Mangalore, that is Manipal Academy of Higher Education. And after that, I did my master's in Government Dental College. It's again very hard to get college, but then I did score well and got into that college. And I took up a subject called oral and maxillofacial pathology. And taking up that subject again came as a blessing in disguise for me, because we are now able to see the pathology of the, in the teeth in a very broader perspective, and able to give a holistic treatment to the patients, just not the treat the the discomfort.
It's not limited to the teeth alone, but to the holistic health of the person.
Yeah, we now have a holistic approach towards our patients. So that is giving them a greater satisfaction when they come to our clinic.
So dentistry today is not only about teeth, it's actually health as a whole.
Yes, of course. It always has been. It's just the awareness now is increasing.
And beauty as well, I believe.
Of course, yeah. That always is.
I believe you're a gold medalist, doctor.
Yes, I in masters, my Masters of Dental Surgery, that MDS, I did get gold medal, yes. And undergraduate, as in one of the subjects I did.
Awesome,
yes.
Awesome.
Yes.
And I understand the first 14 years after college was more of as a faculty in academy.
Yes.
Okay. What was the profile, ma'am?
I worked in college, DAPM Dental College for first 5 years. And after that, I went to Rajarajeshwari Dental College and worked there for another 11 years. So it's been 15 to 16 years of my academic journey. Yes.
So you were both a faculty as well as leading a team, or as a faculty alone?
I was faculty, and we also get to see the patients pertaining to our department.
Okay.
So that has been my experience, and I've involved myself in a lot of research activities, as in oral cancer research activity, and I have also got a patent in developing a processing system of the tissue processing system to make it rapid.
Okay.
Usually it takes 36 hours for a tissue to get processed, but now we can do it in 6 hours with a very, very less cost.
And this can be deployed at site with a less cost, so you can get an outcome, like you can diagnose early.
The tissue for which through which we have to diagnose a disease comes out very quickly with this processing system. Yeah, so that I have patented under Indian Patent Act.
Similar to a biopsy or something?
The biopsy tissue which is taken out of the body
is processed early.
It is processed early. Otherwise, we need 3 working days to get a report.
No, obviously, I think it is within 30% of the time you're able to sort of give an intervention.
Yeah, there are systems which are, quickly you can chairside equipment are there where the report can come in minutes, but that setup is very expensive. Such as cryostat and all are there, but they're very expensive setup. So not all can afford that. Yes. So the system that I have developed is very affordable, very, very reasonable system, and everyone can understand and do it. Perfect. It doesn't require a big technical skill.
So, ma'am, today's world, if we look at the challenges in education, right? So you have been in both parts. You've been a student as well as you have been a teacher. As a faculty, right? Yes. What are the challenges, if it has evolved today in this particular field? What are the students facing as challenges? Let's say if you look from a career standpoint and a curriculum standpoint.
Yes. The curriculum has been pretty much the same. What is required to treat a patient has been taught to us when I was a student, and is being taught to the students.
So that's the foundation, I believe, is the same.
Yes, that is always required. And of course, the advancement has happened in the industry, which we are teaching, and we have to always upskill ourselves, reading a lot of articles, and that also we impart to our students. So the students, when it comes to them learning, the competition is too high.
It's high.
And the distractions around is too high for the present day students. So as an academician, I felt that students need to be focused a little more than they are. But yes, as far as the learning goes, yes, we train them. We always hold on to them and nurture them with our training and all that is fine. But once they finish their course, what we see is the placement issue is definitely very high. If they don't meet the standard that we are expecting to start their clinic. So what happens is very quickly, as when they start the practice, because they are not seasoned or mature enough in the field, they fail very quickly and they get disappointed and stop trying. So that is what is,
because there is a lot of investment also to
very much. It's very expensive
to
set up.
Start,
yes, to have a very standardized equipment.
And today's consumer also expects a lot in terms of which has to be, you have to be really good at what you do to build your brand.
That is true. That is true.
Because I think everything is around social proof today.
Yes.
So everybody goes to Google, everybody sees ratings, what others have said, all this sort of stuff.
Yes. So that is what I found very interesting from academician to a clinician. Now the reward I get is very immediate. Correct. Whether it is good or bad, I immediately get to know what my patient is feeling. So that effort is always there to get a good reward from my patient.
To improve,
so,
yes.
Yes. So every day I'm working on my skills. So it is everyday learning.
So it's always learning, even though you stopped,
studying
a long time back.
It's always studying and always a student when it comes to, because each patient comes with a different challenge. And every tooth is very different. So what I try in one patient may not work in this patient. So we have to keep updating ourselves and trying new things.
So it's always learning new skills, new techniques.
Always.
Got it. So to understand a little bit more about your brand, like Shubhakara Dental Clinic, right? I believe this is 4 years now. The brand is how?
Yes, we started 2021 January.
So why did you take this jump into entrepreneurship after being an academician?
Yes, it's a funny story. So I was in academics and, I was swarmed with so as we become seniors, we get a lot of clerical job as well. So that wasn't very interesting for me. So I kept asking my head of the department that I would like to take a break from academics now. So that's how it started. And I wanted to take a small break. My son was in 10th grade, so his exams were nearing. So I applied on leave and I was on a break. And exactly at that time, COVID happened. And when I was at home, I gave a lot of thinking that now it is time to do something different with my life, that I have been doing this and I have tried this field. Now, why not do something that gives me a lot of satisfaction? The whole purpose of me of joining, become a doctor was to serve people directly. So it was a very indirect way when I was an academician. So I decided to jump into clinical practice. I started with a friend and here we are.
So then you have more control of your time. You also have more control of your output. You're able to contribute a lot more to society and to community.
Yes, right? Yes. I have time for my family. I have time for my patients. I am able to do what I want to do with my patients, and they are happy. I'm happy.
You're also realizing your dream of serving more people.
Yes, very much. Yes.
So I hear a lot of people when they talk about Dr. Shyamala, the first thing they tell me is, dentistry is something where the immediate image which comes to mind is pain.
Yes.
Right? So either I'm going to lose a tooth or I'm going to do something or they're going to put injection or whatever. But they say you go to Dr. Shyamala's place, you don't even know something has happened. How do you develop that sort of skill set?
See, I can't say it is completely painless. Please take my word for it.
No, I had that experience when I came to your place.
It depends on what the treatment that we are giving to the patient. Yes, I try to make it as painless as possible by comforting them. See, the minute they walk into our clinic, whether it's a baby or an adult, the fear, it is...
anxiety is...
Yeah, it is very overwhelming to, first of all, enter and allow them to work in a place you don't want to, and sitting on the chair under the spotlight. So it is very, the patients become apprehensive at that time. So every sensation is, it becomes highlighted at that point. So even if it's small pain, feels very big in the patient.
True.
However, with that, so we have, to make it very painless, we do use, talk very comfortably and make them comfortable on the chair for some time. And then we have to anesthetize the area. So I just tell them that this small prick, that is the only pain part. After that, the pain is not there. So we make sure that if it is there, please let us know. So we stop and we give you some more time to overcome that pain. So it's mostly comforting the patients is
So it's more of a psychological and a technical sort of combination.
Yes.
Psychological, you make their mood sort of
exactly. So they have to get acclimatized to my clinical environment and with me.
Yeah.
And only then.
So once you build the trust factor, then you translate to a technical sort of
That is true. That's true.
Fantastic. We would like to know a little bit more. I know that, a lot of your initiative is towards creating community welfare or make an impact on community, especially those who are not able to afford, expensive treatments.
Very true.
Today. Yeah. I would also, so let's answer that part first, and then I have another question for you.
Okay, sure. So we are, in our clinic, Shubhakara Dental Clinic, we want to provide treatment to all as much as possible. As you know, dental treatments are very expensive because our clinics and our setup comes with an expensive equipment.
Yes.
So not all can afford dental treatment, but that doesn't mean that they should be deprived of the dental care that they need. So what we are doing with the income that we get, some 25% of which we keep for the community programs, where we drive them to come to our clinic, where they can get the treatment done at a either very nominal cost or free. Sometimes we do free.
So it's highly subsidized or it's free for
free? Almost, it's completely free. So we just ask the patients and we deliver the free treatment. This way we are able to reach a larger population and make them disease free. So this way, I feel that the dental disease burden in the society will reduce. This is an imagination I have maybe, but I'm sure at one point, if we all do it, it should happen that way. The disease burden will definitely reduce.
Completely agree, because today oral hygiene translates, like we discussed earlier, it's more holistic than just around the dental hygiene part. But just before that, I'm very interested to know more about your initiative under the tobacco farming belt, which you were part of.
Yeah, when I had taken up my research work on oral cancer, a pre-cancer condition called as oral submucous fibrosis, where most of my work has happened, we needed the tissue samples. So we were, going for camps and all that, and with, of course, permission from the authorities. And we did one camp in a district called Soraba. It's near Sagar district, I think, in Karnataka. And there they grow areca nut.
Okay.
And since they grow, they end up eating as well. Not just that, they also give the areca nut to the younger kids who are accompanying the parents or the grandparents. They also have access to this areca nut betel nut.
Is this part of pan masala also areca nut, or that is different?
It is the same.
It's in pan masala combinations
we have,
comes in pan masala.
Correct.
Okay.
So that areca nut, when they eat, it has. So that leads to development of cancer because they have eaten it for a very, very long time.
So similar to tobacco, sort of.
Yeah, tobacco is also sometimes added to the betel nut, but this is just the areca nut, the raw areca nut that they eat. What they grow, they have just been eating that.
Wow.
So that releases a lot of carcinogenic agents, and many of them had some precancerous stage in the mouth. Some of them at the age of 18 years already had turned into cancer.
Malignant.
The lesions had turned into cancer. So when we got the biopsy done, we did the testing and all that. The report came as cancer and precancer, and some of them we guided them to go to Kidwai. So it is very scary to see that,
happening the whole community.
And they are unaware of it.
They're not aware of it, exactly.
Not at all.
So if it were not for you, they would not know about it. And
probably not, but at a very later stage. Yes. So this is very scary. So if we have to have more and more such drives happening.
So how are we going to drive solutions like this, doctor, to community? So this is one community which is into the areca nut growing.
Yeah.
But let's say if you go to the tier 2, tier 3, like rural levels, how do you think that we can drive any sort of initiative? Or could you tell us more about the holistic part of the dental?
Right. So how do we take the expand it? Maybe I will need a lot of help from every dentist in the city or everyone joining hands with. So would like to definitely
So from an awareness standpoint, if you see today's normal families, either in the urban population or in the rural population, how much is their awareness about the, the holistic side of dentistry?
Yeah, it's at this point less, but yeah, it is increasing now. So it will be good if we can drive those initiatives where we can go tell them what happens if they don't take the dental treatment seriously, or they don't come for regular checkups, or if they don't have good oral hygiene habits. So, and how it affects the general health, because the same bacteria is running everywhere, and the same bacteria can affect the heart and the liver, kidney. Sometimes patients have some organ transplants, and they are the site where the bacteria can get attracted to some process called as anachoresis, the bacteremia, and lodging.
It comes from the mouth. It goes into different organs.
Yes, it is. It's a
in a worst case level.
Right.
Wow.
So those are the organisms that need to be kept at a lower level in the oral cavity. So that is in dentist's hands. So basically that awareness is needed to be.
So how do you reduce it now?
By treating them, by filling the cavities, by removing, cleaning.
Okay, open cavities are the ones which drive
they have millions and millions of bacteria,
and the gum
diseases that patients have. That also has, the plaque itself has millions of bacteria in it.
Wow.
Okay, so regularly cleaning it, teaching them proper brushing technique to remove it by themselves. All that is needed, and it needs a lot of reinforcement as well, because one teaching may not help them. They need to come, and we need to go to them to repeatedly reinforce those techniques.
So at least once a year, like if you look at a family, you have children, you have teenagers, you have adults, you have seniors, right? So what would be the frequency level that you would advise?
Yeah, if
a visit for a checkup.
Yeah, once in 6 months should be good.
Should be the ideal.
Enough. Yes, ideal it is. And so they can come.
So from this holistic perspective, that would actually give them an understanding of maintaining their oral health.
Yes. Okay. So most of my patients have a recall system every 6 months they are being called to the clinic, and they come, they get a checkup done.
So it's not only the dental part, it's actually a preventive healthcare process.
That is the most important part. Yeah. So at any level, if for example, if the patient has absolutely no cavity, they also need to come once in 6 months, so that we keep checking for the new cavities if they have happened, so that the treatment happens at the earliest.
I think you compare this to any of the even if you go for a complete checkup, I think this may be cheaper than that.
Yes.
Like before taking all the parameters, I think a dental checkup may be the first point, which is actually an economical
because it's
solution.
The entry point of most of the diseases. Yes.
Sure. So what's the way forward for Shubhakara Dental Clinic in your mind, Dr. Shyamala?
Yeah. So we are now at a stage 4 years old, and we are having a very satisfying practice. We are looking at, of course, reaching more people, more population, and we are doing a lot of school camps where we can bring younger kids and give them the treatment, preventive care. We are looking at treating everyone with the care that they deserve, for which I will be needing a lot of help from communities.
You need help from
colleagues,
both sides, from a provider level as well as from the community level.
And I would like to make many of my students who need to learn things, so they can also come and
understand more about.
Yes. Okay. And it's not just the treating part; it is also the soft skills that a doctor should have. To
starts with the mindset.
Touch the hearts of the patients, yes.
True.
So that is also a very important skill that doctors need to learn.
Right.
So we are looking at educating patients and students and ourselves with this every day, and learn this more and reach more people.
Okay. It's been a real pleasure, Dr. Shyamala, talking to you.
Thank you so much, Joe.
And we would like to know more about your core team, and we would, wish you all the universal blessings that you should do both on your personal front, for your clinic, as well as for the community. I think that's a bigger impact.
Thank you so much, Joe. It is really a pleasure talking to you. Thank you.
All right. Hi, as part of Shubhakara Dental Clinic, we have one of our core team members, Dr. Sarita, who is now part of the Shubhakara Dental Clinic core team. And she is now approximately completing, she's finished 8 months. She's completing a year association with Dr. Shyamala of Shubhakara Dental Clinic. And today we would like to understand a little bit more about her journey and why she chose SDC to associate with. Welcome, Dr. Sarita.
Thank you so much, Joe. Thank you.
And it's been a pleasure. I mean, I've got, as part of Dr. Shyamala's brand, right? I think we met close to when you were about to join.
Yes.
Or you were looking at that decision to
join.
Making a decision to join a company, a brand, right? So before we get into that, may I know a little bit about your career journey, right from your schooling, where you're from, and what was your progression towards where you are today?
Yeah, so I have, actually I'm from Andhra Pradesh. So I did my BDS in GDC Mumbai, and then I did my MDS in oral pathology from GDC Nagpur. My father was based in Maharashtra, so that's the journey. And I kind of fell into this profession.
I was about to ask you that. How was the decision? Was it natural or was it?
Actually, in our generation, it was either you are an engineer or you're a doctor. So it was the same thing. If you have an aversion to maths, you pick biology.
True,
that was how I took. I was a pretty good student, so I didn't like maths, so went into biology.
Was the focus on dentistry at that time or just a doctor?
Absolutely not.
Okay.
I just took biology, and then actually I wanted to get into research.
Okay.
But then I got really good marks in my plus 2. So then I was like, okay, maybe I should look. I was not very interested in medical. But then somewhere I met my father's friend's daughter who was doing her BDS.
Oh, okay.
So actually, until then, I didn't even knew much about the profession of a BDS. But then she told me a little about it, and I found it very interesting. So then I said, though I could qualify for MBBS, I thought I wanted to try this.
So this was soon after 12th, like when you were going to choose a degree?
Yes.
Okay.
So then that's how I took up dentistry.
Which college, ma'am?
I'm from Government Dental College, Mumbai. So that is, I joined there. And I did 5 years of my BDS over there. And then I actually wanted to start up a clinic after that, post that. But then while working in somebody's clinic, I realized that post-graduation is also pretty important. People would prefer if you have a postgraduate degree. So then I studied again for my post-graduation and got into...
So was there a break in between? Like, did you start working in between before post-graduation or straight away?
There was a 1 year break.
1 year break.
Yeah, because you have these pressures of getting married. So you're finished undergraduation, so parents wanted to get married. But then there was a break. So I thought maybe, I'll take a break.
Did you practice during your break?
Yeah, I was working in a clinic.
Okay.
But then I realized maybe post-graduation also is a plus point.
From a customer or client standpoint.
Yes.
That has more credibility or value to that.
Yes. So then I studied for my post-graduation and I got in. So there was a gap of about a year. And then I did my 3 years of post-graduation in oral pathology from Government Dental College, Nagpur.
Okay. And after that, doctor?
After that, I came to Bangalore. I got married and I came to Bangalore. And then I started working in a dental college, DAPM RV Dental College. I worked there for 16 years as faculty. And I was an associate professor over there. And then about 2 years back, due to personal issues, I wanted to spend more time with my daughter. It's very small. So I decided to stop working.
So is that while you were working in the college as a faculty, you met Dr. Shyamala?
Yes. So in my second or third year of in the APM RV Dental College, she joined. Okay. So that's how we met and we became best friends.
Nice.
So
the relationship precedes the business association.
Oh, definitely. Yeah. Okay. So know her through and through.
Okay. So that gives you the confidence to take that plunge.
Yes.
To become part of a brand.
Yes, definitely.
So, looking at SDC as a brand, obviously your personal relationship is much bigger.
Yes.
I know that would be a major reason why you would have joined Dr. Shyamala. But looking at it from SDC as a brand, what do you like about the brand or about the initiative, about her mission statement towards the community or towards individuals? Yeah,
so the thing, not that she's my friend, but the main thing which always I appreciate in her is she's very ethical. She's a very ethical person. So she will do what is right for the patient. So that I strongly, I agree with, and I
resonate with that sort of.
Yes, absolutely.
principle.
So she's completely into ethical, and she gives the patient the prime importance. She will, when she takes a decision to treat the patient, it is, she's going to give them, it's not financial
It's
or
what
economical.
best for the patient.
What is best for the patient, she will give.
Okay.
And so that is one very important thing. This I've seen throughout, whether it is dealing with a student or a patient. So that is one. And then secondly, her belief in giving back to the community.
Back to the community.
That is also one core belief which I really, want to, because at this stage of my life now, it's not like I've gone into academics, but I would like to serve society.
Sure.
So she is really passionate about that. So I felt while associating with the SDC, I will also get to contribute a little to society. So that is another thing. So these are the main things which
which you took into consideration while making.
Yes.
Okay. And so being part of the core team, again, we just went through what her vision is for the future, right? Just one sort of question is, so when you're mapping your career path, obviously you have your own goals, right? Other than the corporate, the SDC's goals. So how do you see yourself moving to the next level? What is the next level for you? Other than SDC, on a personal point.
Personal point for me, it is, I want to get into a stage where I want to give back to society. That is...
So that is the number one principle,
that is the number
which drives us. Okay.
Yeah.
So maybe initiatives even within SDC where you can contribute more towards giving back to community, or maybe contributing to creating the resources for that. Might be a next step.
Yes.
Is that correct?
Yes, that's very
okay. And so I think that's a mission statement. It is completely different from normal, brands which are more into profitability or revenue generation or expansion, something very different. And that gives the consumer a very big confidence. So the reason we were looking at associating with SDC as a mentor is because this is the mindset which people expect from a doctor or from a health professional. Obviously everybody is going to, the value is always provided. But if that is with an intent of, keeping the customer's best interest in mind, or that translates to customer, family, community, ultimately a big population. And I think that sort of, today's world, finding somebody who is more selfless in their profession is very rare. Right? So it's been a blessing. It's been very good to talk to you, Doctor.
Thank you so much.
And I wish you all the best.
Thank you.
Within Shubhakara as well as personally.
Thank you so much.
Thank you.